members of this consortium are social work policy instructors, and we actually welcome any and all who have an interest in social work policy, whether you're a student or an active social work professional. We welcome anybody who's interested in the topic, and we have a steering committee that works really intimately with the chapter to make sure that these capacity building opportunities and these peer spaces are really cultivated with social context in mind, and so that they're relevant to your current practice and to your current teaching. This event is actually the beginning of a series, and so I'm going to ask my colleague Lucia to drop the link in the chat for our entire for the information for the entire series. You'll notice that we are recording because we will make it available on our YouTube channel. And if you all have any questions, Dr. Manalo, who's facilitating this event, will actually facilitate questions at the very end. My colleague Lucy and I will be tracking questions in the chat. This is a meeting style, so just type it in the chat and we'll track it for you, and we'll get them answered at the very end. So it is absolutely my pleasure to introduce my colleague, Chapter Board President, Dr. Victor Manalo, to the virtual stage to facilitate today's event.
Thank you, Deborah. Thank you, everyone, for joining us this afternoon. This is going to be this has been kind of, we've been talking about this for a few months now, and I do have to kind of send out props to my colleague, Margaret Lee from Azusa Pacific University, whose idea, this consortium began with her. Much to my chagrin, I'm very jealous that she came up with that idea. But it's so great that, you know, we have colleagues that have all these great ideas and come to the table and say to NASW California chapter and saying, hey, what can we do with this idea? And here we are. So I'm really excited to be here with you here today. My name is Victor Manalo. I'm the president of the board of directors of NASW California chapter. Also a lecturer at Cal State Los Angeles, where I've taught for over 20 years, and also a local government consultant and former council member and mayor in the city of Artesia here in Southeast LA County. So welcome to all of you. I am going to be moderating with our three very astute guests, panelists here today, and I'm going to start off by having them introduce themselves to you. And I'll start off with Farah. Farah, welcome.
Thank you, Victor. It's such a pleasure to be here, and thank you for inviting me to speak. I so appreciate all the work that social workers do in our communities, and I also very much appreciate the focus on local policy making that often gets lost in the shuffle. And so really happy to be here today. I work for the California State Association of Counties. It sounds like a state department, but it's not. We're a nonprofit association that represents county boards of supervisors members. We have all 58 California counties as members, and we represent them here in California in the policymaking process and at the federal level. And then we assist with some of the local policymaking. So again, I'm really excited to be here today and to talk about this topic.
Great, thanks, Farah. Welcome. And Bryant.
Victor, and welcome everyone. My name is Bryant Vargas. I'm a recent BASW graduate from Cal State San Bernardino, and I am currently a staffer for San Bernardino County 5th District Supervisor Joe Baca Jr. I serve as a policy advisor in his office, and I'm just super excited to be here, so thank you for the opportunity.
Thanks, Bryant. And at last, I'm very happy to introduce you to my good friend, Dr. Nicola Alenkin. We have been, we've been through it together for a number of years, and I'm so glad that I ensnared him to get involved with NASW here at the local level. So, Nick.
Thank you so much, Victor, and thank you, Deborah. I just can't say no to either of these people, so whatever they want, but I'm very honored to be here and to share some knowledge. This is really important. As many have mentioned before, local level structures and political systems are so complex. So hopefully you will gain a little bit of deeper understanding of how they operate. So thank you so much for having me here.
You're welcome.
Oh, that wasn't me. I don't know who said you're what. Maybe that was Siri. Siri was chiming in there for a second. Siri's really excited that we're doing this today as well.
She's overseeing everything.
Absolutely, absolutely. So, you know, Nick, you kind of, I'm sorry that I'm going off the script here, but I don't think this is going to be a difficult question for all of you. But I really would like to start off by saying, you know, and some of you have alluded to it already. Why is it important? Why should social workers know about and be active in county level policy? And we talked earlier about the fact that in our education, it's pretty much ignored. Anything on the local level is ignored. We focus a lot on federal policy, and a little bit on state policy. But why do you think it's so important? And all three of you have experience in working with counties at different levels. And so, you know, what is it? Farah, would you mind starting us off?
Sure, happy to. Thank you, Victor. You know, the local level politics are, as you mentioned, they're very complicated. The California overall is very complicated on these issues, but the local level politics really have the power to not only bring the policymakers, meaning the Board of Supervisors in this case, together, but also the communities. And also by working at the local level, you may be able to focus on special issues or populations within the local level community. Now, county lines are arbitrary, right? We know that many of the issues that we try to focus on cross county lines, but by working at the level of that's covered by your county Board of Supervisors and their departments, you really can enact some change and get some movement. I say that with a grain of salt, and I think that Dr. Lincoln and others will mention this. Counties, we do offer many of the social services, behavioral health services, and public health services that you are all probably very familiar with. We do that on behalf of the state in many cases. The state has delegated that those responsibilities to counties. And then of course we do it within federal guidelines. But knowing that, and I know everybody on here already knows kind of that basic outline, the local level, the boards of supervisors really do have some choices in staffing levels. Of course, there are many state staffing requirements, but the local level, especially for special initiatives or populations, the Board of Supervisors has quite a bit of leeway to undertake special initiatives. A great example here in Sacramento County, which started about 7 years ago, is the Black Infant Health Program. It's a local program, although there's a state program by the same name, and really brought together a bunch of different community members and groups. And the Board of Supervisors earmarked $10 million over 5 years for that effort. And we're just now at the end of the 5 years, and they're earmarking funding for an additional 5 years, hopefully. So those are really good examples of taking on special issues. But also at the local level, there's those large issues that cross all the county lines. Again, the staffing levels, the how you respond to children who may be in danger, that you get a call, that Child Welfare Services gets a call for. How do you respond to somebody who is in the ER with a behavioral health crisis? And so at the local level, the decision makers really can help direct some funding or focus on certain areas that are in dire need. Again, we have to do that. Counties have to do that within a very rigid federal structure and a state structure. And the way we do that is we braid multiple funding streams together: state, federal, local money, Mental Health Services Act money, if you're familiar with that on the state level, philanthropic funding, local taxes. So there's a number of ways that we braid the funding together, but the county supervisors are able to, again, especially those local taxes and funding, as well as unexpected funding and say the COVID relief funding that many counties and cities are expending right now have presented an incredible opportunity, probably once in a lifetime opportunity for our communities to let our boards know what's important to us, because that funding, that federal coronavirus funding, is fairly flexible. So we are seeing a lot of really great initiatives, and that's a great example. And we're hoping that it sets a precedent, not only for the federal government sending, flexible funding to communities to address what they need to address, but also the community engagement and the focusing on, again, the needs of each community with this funding. I'll wrap it up right now, Victor, but I'm sure Dr. Lincoln and others
have. Thank you.
Yeah.
Thank you, Farah. I appreciate that. Yeah, so that's a great start to our discussion. Bryant, we had a chance to meet over the last couple of months, and I know that you're a recent undergraduate student and graduate, and who didn't even start off, you told me, like really interested in the policy arena. So you must have a very kind of a unique point of view on why we as social workers should be cognizant, and for policy instructors specifically as well, why we should be talking to our students about county level politics and policy.
Thank you, Victor, and thank you, Farah. Yeah, on a day-to-day experience, a level on the experience I have, I can compare it to a lot of casework. For my internship as an undergrad, I was a caseworker at the Ontario Montclair School District Health and Wellness Services Center, and I got to do that alongside doing an internship at the Board of Supervisors at San Bernardino County, and the similarities were uncanny. The amount of brokering I had to do, linking, referrals, and just being able to use my relationship building traits and techniques, warmth, empathy, genuineness, to take a phone call, be able to assess the situation, reassure the person, and then be able to refer it out in a timely manner, and just be aware of all the different county departments, the city units of government that would be involved, the nonprofits, etc. So like on a day-to-day, I feel, for a social worker where I'm at, just having your social work skills, even as an undergraduate, they would serve you very well, to be able to do that, to interface with people, which is what we do. We do that on a daily basis, just interfacing with constituents, but then kind of more on the county-wide level, right? When we look at San Bernardino County, the largest county in the US, by surface area, and we look at specifically unincorporated parts of San Bernardino County versus incorporated parts. And what you realize, I represent the 5th district, which includes incorporated San Bernardino, Rialto, Colton, but then unincorporated Muscoy, Bloomington. And when you look at those areas, if you were to do a needs assessment in 5th district, you would see a lot of the need is in those unincorporated areas. And when you look at unincorporated areas, you realize, there's no mayor, there's no city council, right? They could, like Bloomington has a MAC, right? A municipal advisory council, which was a request that the residents of Bloomington put forward to the 5th district supervisor to create this forum where they would be able to kind of have their own board and talk about Bloomington issues. So when you look at the lack of representation there, the county level, especially your specific supervisor, becomes so important. My supervisor, right, Joe Baca Jr., he very much feels, and this is kind of the narrative he tells the people of Muscoy and Bloomington, he's like, I'm your mayor. I'm the guy that you need to reach out to when you feel that your needs are not being met. And when we talk about the needs in unincorporated areas, I mean, compare them to the needs of incorporated areas, we're talking about infrastructure. We're talking about not having sidewalks. We're talking about not having street lamps. We're talking about rampant crime, rampant, issues like that, where it's like, if they can reach out to their state representative, and we have very active state reps in this area, absolutely, I can vouch for that are very involved, very engaged. But the reality is a lot of these issues are day to day, and they need to be met on a day-to-day level, where you need to reach out to your supervisor and you need to address it at the county level. So I would say social workers absolutely need to play a part at the county level when we're looking at those disenfranchised and unrepresented areas in the county.
Absolutely. Yeah, great. Thanks, Bryant. Obviously, there's a lot of work to be done for social workers at the local level, in the county, across counties, right, as Farah was suggesting, and at state and federal levels. And certainly there are, and I think the great thing too, Bryant, is that our skills as social workers are so applicable to this arena. And I find many students feel kind of daunted and overwhelmed by the prospect, or biased because of their negative perceptions about government and politics, that they shy away from it. But it's so important. And the other thing about that, both of you mentioned, which is why I'm such an advocate for local government, is because it's right in your backyard. You don't have to. If you're in Southern California, you don't have to fly up to Sacramento, or you don't have to go to DC, or you don't have to travel far to, to really be engaged. So great. Thank you, Bryant. Nick, what can you add to our discussion here from your point of view? Why is it important for social workers to kind of get to know counties and understand counties?
Yeah, thank you, Victor. And I think Farah and Brian have done a great job of talking about the scope of everyday problems and issues that people face. All of those lie flatly in the hands of city and county, elected officials and policymakers. So we can think kind of broad term, and I think for most students, they're easily led to sometimes the larger problems, to think about them as large problems. And then when they're faced with some of their own personal or local issues, they may have a difficulty of saying, okay, this is very similar, the skill sets, as Bryant mentioned, these are very similar to the things that I can do with someone that I'm working with on a micro level, right? And we often forget that, our neighborhoods, our communities, the places and the people that we interact with on a daily level, these are all governed by folks in local municipalities and county government. And the complexity of it, just as an example, in Los Angeles County, there are over 36 different county departments that deliver social services within the County of Los Angeles. And we're talking about over 88 cities within the County of Los Angeles itself. And Brian talked about incorporated versus unincorporated. We could probably spend a whole another hour on that conversation. Those unincorporated areas.
Clinic with US Renal, who has moved to Murrieta, and
those unincorporated areas have their own governance. So I think the important pieces here are for social workers and social work students and social work professors that are teaching policy, really having people connect to what are the personal issues and social problems that they face, and then taking that and translating that to their local government. And it's as simple as starting off with something like a neighborhood block captain, for example, I have in my neighborhood. That block captain communicates directly with our city council person, and the city council person then in turn communicates with the county supervisor that we have. So, starting very small, again, thinking at a micro level, starting where you are at, and starting to look at the social issues and social problems that impact you, are a really good way to then think about these local governmental structures, because it can be really complex. And I'm going to kind of date myself here, but there was a famous Speaker of the House, Tip O'Neill, and it wasn't his phrase, but he used it a lot. He talked about all politics is local and all politics are local. And it really is. So we can think, things that happen in Sacramento, things that happen in DC, yes, they do affect us, but locally here, when we think about what is impacting us on a day-to-day level, it's this local governance that we need to be connected to.
Thank you. Thanks, Nick. That's great. I appreciate that. Yeah, I read that book by Tip O'Neill too. All politics is local. Again, that's really the focus of what we're talking about today. And I know that all three of you have kind of mentioned, this is kind of something that's really interesting to me, and I think as a policy instructor, I would want to know, like, how do social workers get engaged with what's going on at the county? Do they call the supervisor? Do they talk to staff? Do they go to a county board meeting? I mean, in your experience, what are the ways that social workers or social work students could access county government? Bryant, I'll start with you.
So on my end, as far as what the Board of Supervisors at San Bernardino County gets from the various departments, that administer social services, mental health, behavioral health, etc., we mainly hear from department heads. Potentially the deputies, right? Maybe some special managers or administrators that might have specific roles, right? But most of the time we are dealing with department heads, and that's kind of like a regulatory thing. There's a lot of push for transparency where they really wouldn't want individual workers reaching out to Board of Supervisors staff for obvious reasons, right? You wouldn't want he said, she said. So most of the time when we get it, it's filtered through whoever that department head is. Other than that, when we get constituent calls, which is kind of the casework I was referring to earlier, in that case, sometimes we can interface with individual, micro social workers, right? When we get a case number and we kind of, get a call from someone that's like, hey, I'm having issues, with this case I have with CFS, right? Or this case I have with DBH, right? Can you help me out with this? At that point, right, I might have a name, I might have a case number. And at that point, I have to kind of do my research, reach out once again to department heads most of the time. And then I might get something, but because of so many regulations that exist, because of HIPAA, because of confidentiality, because of privacy, right? Oftentimes the supervisor himself, right? And even staff, for the supervisor, we don't get to hear that front line, that boots on the ground perspective. We don't. We get kind of I don't want to call it sterile, right? But it very much is curated. We get a curated view into what's going on in those departments. I would say the opportunity is there for individual social workers to express more about what's going on with their departments or what they're seeing on the ground level, right, in the county. But that requires them to engage most of the time, not in an official capacity, right, but most of the time kind of get civically engaged, make a public comment, right, maybe even coaching constituents, right? That's a big thing that I feel like we forget we can do, is kind of connecting with our constituents, getting that testimony. Oftentimes I'll talk to a constituent that has an issue and I'm like, this issue would be amazing if you could just give that narrative to the board, right? And oftentimes they're scared. So I think we as social workers, as trained professionals, we can use our research skills, we can use our writing skills to kind of coach these people and help them for those 3 to 5 minutes they have in front of the board to make a presentation that's evidence-based, that has that data to support it, that is, just kind of just sound in general, right? So that when the board hears it, they can act and they can get a concise, because oftentimes what we get, the people that do make public comments, right? And I'm over here an advocate for public comments, right? But the reality is most of the time, the public comments we get, they are not like that. They are not structured. They are not, they don't have a focus. They don't have a short-term, mid-term, long-term goal. It's not a proposal, never. We almost never get things like that. And I feel like that's what's missing. And that's the role that we as social workers, right, as catalysts for change, as change agents, we can play that role and we can help our constituents to better communicate with the board. Because the board, I got to tell you, my supervisor is constantly asking, what do the people want? What do they need? And we can go out to as many events as we want, but unless we're getting those specific testimonies in that way, it's very difficult. It's very difficult.
Yeah, thanks, Brian. You brought up a lot of great points. I think, my experience on the city council is that most people show up to city councils to tell us how great of a job we're doing and pat us on the back. That's a joke. That never happens. People people that come to a public meeting are generally there to complain. And if you come with a different point of view, if you come with evidence, and you may be able to to convince a supervisor or two that your issue is something that they need to address, like the things you talked about earlier, Bryant, about infrastructure in a community, for example. Great, thank you, Nick. What do you think about this question of social workers, whether they work for the county or just social workers that live in counties? How do you think they should be ways that they can get engaged with the county?
I think, and Brian laid out really good points, but we might have to censor this recording because he used the R word, research. And data as well too, really critical. I like to remind my local elected folks and policymakers that I actually vote, and my vote counts. And not only do I vote, but I also have influence on other folks that can vote, which include the clients that I work with or are helping or are supporting. And I think that's really critical, is having that piece to help elected policymakers understand the power and influence that we have. And I think that sometimes can lead to this sense of power disparity. We often see, as you mentioned, Victor, folks that go to a city council meeting or a county board meeting, they may not have the most eloquent or most concise or most research viewpoint, and they're pissed off. They're upset about what's happening, and they want change to happen immediately at most times. So I think what's critical, using another skill set that we all have, is really being strengths-based as social workers. So taking really complex issues and breaking them down and finding things that are very positive, that are very resilient about them. Quick example, in LA County and most counties in Los Angeles and across the country, we have an issue of homelessness and the unhoused. And I think if you ask anybody across the country, the number one issue at this point is poverty and the unhoused. In local elections, in county elections, and in federal state elections is the issue of poverty and the unhoused. So policymakers and elected folks want to hear solutions. They know the problem exists. They see the problem. So I think one other thing that's really important, going back to this strengths-based focus, is coming in, and Brian alluded to this, coming in with solutions, right? So yes, I'm upset. My clients that I work with are upset. But this is what we have proposed. We would like for you to do X, Y, or Z. I think that's is a really critical piece of what policymakers and elected folks want to see at local government. They want to see constituents not only saying that they vote, but also saying that they will be part of the solution. And I think really honing in on that is important. Having students practice, for example, an elevator speech that they can do with data points that are critical, that are timely, that can be understood very clearly by the policymakers, and then also talking about solutions that they can propose or have proposed in a very succinct and concise way, again, backed with data and research. I think those things are really critical.
Absolutely. Thanks, Nick. Those are great points. Definitely has to be an ask, right? Sometimes, people come up in public comments and they don't ask for anything. They're just venting or, espousing their opinions, but there's never an ask. And we also have to, and with voting, what that says is we're keeping you accountable. I'm not just here to give a 3-minute public comment, but I'll be back to make sure that you're following through on what it is that, that we're asking. So those are great points. Farah, Nick mentioned, that these big issues that kind of go across counties, like, housing and mental health and things like that. From your perspective, from the state level, working with all these different counties, how would a social worker like myself, who really, I don't work for the county, You know, I'm doing my own work out here in my community. You know, and I'm, you know, if I were really concerned about homelessness or some of these larger issues that go across counties, you know, how could I get my message across at the county level, or you know, to be influential and effective?
That's a great question. And just a quick aside, how lucky is San Bernardino to have Bryant on staff there? Just so great to hear your perspective from the social work perspective. And you're right, those skills really do cross over a great deal. I think that the first thing to understand, and we've touched on it, is the county structure. And typically the department head for whichever area you are interested in. If it's behavioral health, it'll be the behavioral health director. If it's social services, that includes our what we used to call our welfare services like CalWorks, CalFresh, food assistance, but also includes child welfare services, adoptions, adult protective services. And then we have our little public health departments, which nobody knew about until about, March of 2020. I think everybody here knows what county public health does do or tries to do with the resources they're given. So the department head really is a good start or resource. In some counties, they have what we call a super agency. So that means that those three departments, public health, social services, and behavioral health, are all in one agency, and they have an agency head that oversees that. In other counties, LA most notably, they have a standalone Department of Mental Health and a standalone Department of Social Services. So kind of knowing what area you're working in, department heads are always a great place to start. Your local county supervisor is always another great place to start. And then, as Bryant mentioned, county supervisors meetings are public meetings. There's always public comment. And so that's a great way to get stuff on your radar. We like to say, and this will sound a little parochial, but I think it's like 84% of Californians live in an incorporated city, but 100% live in a county supervisorial district. So no matter where you are, if you're in the city or not, you have a county supervisor, and counties are uniquely tasked with those social services, behavioral health, and public health functions. We do get a lot of people, especially during COVID, who would go to their city council and just be really, really hard on them related to public health strictures, and not know necessarily that actually it was the county public health officer that imposed a mask mandate, those sorts of things. So when it comes to the bread and butter of social work, helping people, the helping services, counties really are the ones that provide those three types of services. The other thing I'll say is, and this is a basic concept of organizing, of which I'm sure all of you are familiar. One social worker showing up at public comment is pretty amazing. But if you can have 10 of your social worker friends, plus some of the constituents you're working with, plus maybe a champion or two from, the local community, whether it's a minister or another nonprofit head or the school principal, whoever, recruit people into your cause. Really, it works very much at the local level. It also works here at the state level. I'm so lucky to work with Rebecca Gonzalez, who's been representing the social workers at the Capitol for many years now. And, we here, even at the state level, our associations, we say, gosh, there's this child welfare issue that's really bad. We need to all get together. Let's, CSAC and the county welfare directors, who are the department heads, the department social services heads, and Rebecca and the social workers and labor, let's all get together, and then we'll make our case to our legislators. That can be done at the local level as well. So always think about the folks who you can build a coalition with, including, of course, labor, philanthropy, the faith-based community, other movements. Always try to gather and collect a coalition. That's the main way to get heard at both the local level and the state level.
You make such great points there, Farah, and I think it's important when we're thinking about, for example, those of us who are on the call here that are policy instructors, that the access to county level government can be from a variety of different means.
Mhm.
As both Bryant and Farah and Nick have alluded to,
Mhm.
you know, you can go to you can talk to a staff member of a county supervisor like Bryant.
Mhm.
You can go to a public meeting with a well-organized group of folks like Farah was talking about. You can talk to a department head. I mean, you know, a few years ago, I accosted the department head. I don't want to say accosted, but I met him at an event and I pitched him my idea, and he loved it. And now I'm working with the new department head of Department of Children and Family Services here in LA County to try to keep that program going. So there are multiple arenas of access to county level government. And I think the important thing is that we're trying to let people know, let all of you know that it is important to focus on what's going on in the county and across counties. So thank you for that, Farah. Nick, what you talked earlier, made a very specific point about, you know, having data, you know, being ready to share that data and do your research. What's your sense of kind of what is it that supervisors or county supervisor staff or the county in general, what is it specifically that they want to hear from us, either us as social workers or us as constituents? Are there specific things you think they want to know from us, or they need to know from us?
Absolutely, Victor. And I just want to add one piece that I think is really important, because Farah was mentioning coalitions. I think those are really critical as well too. And associations and unions are really powerful. I know Mr. James Maddox is on the call today, part of an association, huge association that has a critical voice in LA. Joining an association, joining NASW is really key and important, and leads itself to being able to have these access to these coalitions. And then the other piece that wasn't mentioned that I think is really critical are unions. We've seen unionization we had a walkout yesterday, for example, at Amazon Warehouse and a bunch of other places, nursing unions and social work unions are some of the strongest unions that we have, especially at the county level. In Los Angeles, we have the SEIU union that has been so critical in the reduction of caseloads for social workers and wage parity and all of these really critical issues that I think are important. So I want to just mention that. But what do county folks want to hear? What do elected folks want to hear? I think they want to hear the truth. They want to know, as you mentioned, Victor, I don't think anybody comes in goes into politics or becomes elected and has an elected office is naive about that it's going to be, you know, peaches and cream and rainbows and all those things, you know. So I think being really honest and truthful and being critical about what are the social issues that you are experiencing, that the community is experiencing, and having the strength and capacity to acknowledge that it's a collaborative effort. I think sometimes I've worked with county, I've been working with the County of LA on the issue of increasing homebound vaccinations for homebound individuals. And it's been over 2.5 years. And so we've come to this critical impasse where we have the eyes and ears of the Director of Public Health in our county. It's important for us to have our messaging be very clear. So yes, a lot of folks are frustrated, and we as a coalition have been frustrated about this issue. And yes, there are things that the county can and cannot do. But I think it's important to just lay out what is really happening at the ground level. And I think that's where social workers are so critical, because we are the voice of the voiceless and those that are marginalized. So it's important that as a constituent, as a social worker, that you be very honest with the people that you meet with. You know, hey, I'm glad that you voted for
Absolutely.
X, Y, Z,
Yeah.
but these are the areas that I think we could enhance. We need more funding, for example, to get folks to connect to people that are homebound. We need more funding to have social workers so that we can reduce cases, whatever it might be. I think elected folks deserve and need to hear the truth from their constituents, and I think that's important.
Absolutely. Thank you, Nick. Thank you. I'm sorry. I'm sorry to cut you off, but we're getting short on time, and I want to make sure that we leave some time for question and answers. Like Deborah said, this has gone by way too quickly, but I'm going to throw that last question to Farah and to Bryant to kind of finish up on that question, and then we'll go to questions and questions from those of you who are in attendance here. If you have any questions, feel free to put them into the chat, and we'll do my best to get those questions out and have our panelists answer your questions. So Farah, I mean, from your perspective, it's so great to know that there's a social worker working kind of on some of these larger issues across counties. What do you, from your perspective, your vantage point, what do counties need to hear from us as social workers that are kind of doing the work out there on the front lines?
Thank you for the question, and I'll try to be succinct. Truly, Dr. Lincoln mentioned it, the honest truth. This is what's happening in the community. What you may hear back, or what may give an individual social worker or even a group hesitation is, well, we're really focused, such as Nick talked about, on homebound folks who can't get to vaccinations. And some policymakers and others might say, well, that's only 1 out of every 500 of my constituents. It's not a big enough issue for me to care about. And really telling them the truth, and then telling them about how it impacts the rest of the community. We are in the middle still of a giant lesson with the pandemic, the first pandemic, of how an individual's health can affect the whole community, not only in potentially passing on or transmitting a disease, but if a person's ill, they can't be your flight attendant. You miss your plane. You can't go to that job interview. People who are working in the service industry who haven't worked this entire time. The fact that people will say, well, if you catch COVID or not, and how it affects you or not is an individual issue, but we see time and time again, and multiple times a day, it affects the entire community. So being honest about the issue, and then illustrating how it affects the entire.
That's great, Farah. That's perfect. I think, I know when teaching many of my students, I think we social workers many times, and many of my students think that, why don't other people see it that way? And if we elect people, if elected officials are in those positions of responsibility, they should be seeing things the way that we see them. But having been an elected official myself, I know I didn't spend 24 hours a day driving around my city looking for problems. And our elected officials don't do the same thing. They have staff like Bryant, but they can only do so much. So you really need social workers on the ground who are doing the work to really be able to share those stories with their elected officials on their county board of supervisors, or in any of the different ways you could get to them. Brian, you're going to finish us off on this question in terms of what do you think from your vantage point? I know you mentioned to me that the county of San Bernardino just came out with this big plan on addressing homelessness in San Bernardino County. Is that even though they have this plan, do they still need to hear from social workers on the ground?
Thank you, Victor. Absolutely. I think the sources of data that are most important to the county board are actually sources from the county, believe it or not, right? There's so much data that individual departments themselves do and keep track of, and it's very accessible. But when it comes from us as staffers, compare that to when it comes from a constituent, who has written a proposal about it and is pointing out the data, the impact is just different. When it comes from a constituent and they're armed with that data. And a perfect example when we're talking about homelessness, right, is our point in time count data. Right, so San Bernardino County just had their point in time count, first one for the unsheltered population in 2022, right? I think it's the first time in 2 years. I have some Cal State San Bernardino alums that participated in the San Bernardino County point in time count on this panel. So just call to action, right? We need more social workers that are participating in county functions like that. And then as the data is compiled and it comes out, then communicating what that data actually means to their representatives, going to the Board of Supervisors, pointing out, look at this percentage increase of unhoused individuals in Colton, in San Bernardino. Look at these special populations, the populations of interest. Look at their numbers, right? Look at how they're trending. Look at this 5, 7, 8-year trend that we're seeing, you know, and here's what I think we need to do to address this, right? And being able to, something that I think is very important too, that we often forget, is you're allowed to point to other counties that are doing things, right? You're allowed to point to San Diego County doing something amazing, right, with their diversion when it comes to emergency calls, right? When they're getting mental health calls, right? You're able to be like, hey, you know, look at this program that's being operated in this county. What would it take to bring it to San Bernardino County? Like, what can we do? You know, can we facilitate a inter-county meeting? You know, can we get a coalition going? Can we, you know, just touch base on that? But I would say really what I would like to see is more social workers participating in these county type events like the point in time count, and actually using that data to back their proposals and pushing those.
Absolutely. Thank you, Brian. Absolutely. Yeah. And I think it's great that, you know, when I always tell my students, you know, you and all of you who are on this call, all of us fellow social workers, we're the experts of what's happening with our clients on the ground. You know, no offense to Brian, but you know, when you're working in a supervisor's office, you have a very, you know, unless people are coming to you, you have a very limited point of view. But and luckily Brian is a social worker, so he can understand. But most people that are working in county government are not so, you know, at these levels of authority in supervisors' offices, and elected officials are not social workers. So it's really incumbent upon us to be honest and to share what's going on the ground. And I'm so sorry we're running out of time. And if you could let me know if there have been any questions that need to come up. But I also I know that this is a forum for policy instructors. And I think, Nick, did you have something that you wanted to share with the participants this afternoon about some resources they could use in their policy classes?
Sure. Yes, it's in the chat. It's a really simple just overview, just talking about power and local government. And I think all of what we've talked about is kind of embedded there. But I think the most critical thing is, you know, if you're teaching policy, as Brian mentioned, as Far mentioned, and Victor is mentioned in his experiences, having people engage in these activities is so important, so critical. So that can start from just researching a local issue. A lot of times we may not know who represents us in local government. We might know who our senators are or who our assembly folks are in the state, but we might not know who represents us locally. So that's a really easy and critical thing to do. And then researching social issues and social problems that those folks have as their areas of focus in policy, and then going, you know, to events, as Brian and Farah mentioned, and Victor mentioned in the beginning, going to city council meetings, going to county board meetings, but going with the intent to, for a lot of students, I think, initially, for them to just experience what the process is like, and to see, you know, in LA County, we have 5 individuals in the Board of Supervisors that have legislative, judicial, and budgetary and fiscal oversight for over 10 million people. So, you know, you want to see, who are these people? What are their backgrounds? What have they done in the past few years? Have they connect it to constituents. You know, those are really important kind of basic things that you can do. So it's all there.
Thanks.
And I know, yeah, I know we're all available also for questions if folks have them beyond this, you know, topic as well.
Absolutely, absolutely. And speaking of questions, Nick, I think Deborah, did you say that there were questions from the chat that you wanted to?
Yeah, there are a few from the chat, and it looks like we've got about 7 minutes. So the first one is, who can we direct frontline social workers to who want to share their stories about high caseloads and poor work conditions, namely spaces like child welfare or county behavioral health?
I would say unions. Go to the union folks. I think that's key. And if you're not unionized, learn about how to unionize folks and start something in your agency. You know, I think that in and of itself is a great advocacy experience and tool.
Great, thanks, Nick. Farah?
I would say, you know, contact your county supervisor or their staff and explain how, you know, that's affecting the children and or, you know, the people with mental health issues in their community.
Okay, great. Yeah, that's great. I'm always directing my students to staff. Bryant, you could probably chime in on this too, but staff are much more accessible than the supervisor himself or herself. So what do you say to that, Bryant?
Yeah, please. If you go on a county supervisor's website, you see most have their staff there. You can see the background of their staff. Reach out to staff directly, because oftentimes, I'm not saying it won't be read if you reach out to the supervisor themselves, but if you reach out to staff, especially someone who is passionate about a particular issue, you're more than likely to get a response. And then when it comes to things like caseloads, well, honestly, the way the supervisors hear about high caseloads is usually when we see departments dropping the ball, right? When we see outcomes that are negative and not going well, all of a sudden the board starts paying attention to caseloads. So as a frontline worker, you guys are experiencing that the ball dropping way sooner than the board of supervisors. So as soon as you're experiencing that, that's when you need to start making staff aware and saying, hey, this is going to lead to terrible outcomes. We need to address this, not just for staff, but for our consumers.
Thanks so much,
Thanks,
everyone.
No, that's great. That's excellent.
Oh, sorry, there's a slight delay, but I have one more question. It looks like we have a few more minutes. How can students who are interested in policy get more involved? And specifically, you know, how can they build up knowledge related to the legislative cycle, to you know, how to analyze bills, things like that, especially given social work programs don't have a heavy focus on these types of curricula?
I'm gonna say,
great, thanks, Deborah.
Yeah. I'm gonna say you need to take Dr. Manalo out for lunch, and he can tell you. I mean, I've learned, and I'm not joking. I've learned so much from Victor. He's an excellent resource. So I think connecting to those policy experts that you have, whether it's in the academic programs. Thea was mentioning, you know, taking an organizing class, taking a you know, policy course, talking to your policy instructors, you know, and you know, I think also, but at the same time also talking to your neighbors, you know, learning that way. What are the policy structures and systems? There's so much wealth of information in communities and neighborhoods. There are so many little mom and pop places where there's discussions about policies that you can get involved with. So.
Yeah, and I would just
Absolutely.
put in another plug
Thank you, Nick.
For the statewide associations. If you're a social worker that perhaps works in a county, again, there's the County Welfare Directors Association, there's the California Behavioral Health Directors Association, and they do a lot of policy work, and that's a great entry point for anybody wanting to learn about policy and the legislative cycle.
I would also say I minored in public administration in my undergraduate program, and it helped so much. So for anyone that wants a breakdown of the policy process, of how things happen at the local, state, federal level, I say go and take a public administration class, see if it's for you. We're lucky that CSUSB has a dual MSW MPA program, which is amazing, right? I know I have an alum who's doing it right now, and I think programs like that are so important if we want to cultivate social workers who then become these public administrators of the future. And as Rebecca plugged, and so many people are plugging now, go to lobby days. Just go to lobby days and experience how amazing it is to interface with your state representatives, to learn what it means to lobby, to learn how to organize impromptu like that. It's just an amazing experience, and I can't advocate enough for it.
Thank you, Bryant, and thank you for all the great resources and information and concepts and everything that the three of you have shared with us this afternoon. I want to, if we could, just give a round of applause or somehow express your gratitude in some way to our three panelists, to Bryant and Nick and to Farah. Thank you so much for everything that you've shared with us today. Keep in touch, all of you who are here, because we are upping our policy game here in the California chapter. So now we're building upon just the great success that we've had for years in our lobby day event. We just did a lobby day for professionals a couple of weeks ago, and we have this policy consortium, and we're really trying to get our members much more engaged and active in policy and advocacy. So please stick with us, reach out to me or to Deborah or to anyone on staff, to Becca or Raquel, anyone on staff. We will plug you in. The last thing I will say before we go is use your relationships. The last question that we got was, how do you get involved? Just use your relationships. Meet the people you want to meet who will give you an insight as to what's happening. As Nick said, it could be your neighbors. It could be a staff member at a supervisor's office that you went on the website and you found out that he's a social work graduate from San Bernardino. So you want to take him out for coffee. You can always take me out for lunch. As Nick said, he knows that I'm easy. I'll, a lunch, even coffee. I'll go out and have a cup of coffee with you. Or reach out to any of the resources that are available to you, and just start by making those relationships. Make relationships with people who can teach you and guide you and mentor you through the policy process. So thank you so much, everybody. We welcome all of your feedback and your suggestions for future consortium activities. If you want to be a part of our consortium planning committee, you are welcome. Please feel free to reach out to me or to Deborah, and we'll make sure that you get plugged in. So thank you very much, everybody. Anything else, Deborah?
No, I think that's it. You covered it. Sign up for our newsletter at NASW-CA to stay apprised of future events. And thank you so much for Bryant, Dr. Nick. I hope, Bryant, you saw that there are social workers in the chat and in the space wanting to support you in your run for elected office. So if you're ready, we are.
I did, and I appreciate it. I don't know if I'm ready, but I love the energy. So thank you so much for this opportunity.
Thank you, everyone. Take care.
All right. Thanks, everybody.